Speaking of which, we're hearing that from the Central Maine Medical Center, doctors who are working on those 13 who suffered various injuries. Let's go to that.
I would also like to acknowledge the support that we have been receiving since last night from our community partners, beginning with law enforcement. As you can see, there's still a presence here as we speak. We have also been supported by our hospital partners in dealing with the patients that we treated last night. They all offered support, and they came to our aid just when we needed them the most. And then we also greatly appreciate the support that we received from our local community partners and other agencies such as Lifelight of Maine and professionals that came to aid the team that was caring for patients here last night. So with that, I'd like to introduce Dr. John Alexander. Dr. Alexander is the Chief Medical Officer of Central Maine Healthcare, and he can give you more specifics on the numbers of patients and their conditions that we treated last night and continue to care for here at Central Maine Medical Center.
Good afternoon, everyone. I too want to extend condolences to the families, the victims, for this terrible loss. I know that all of our team members, our physicians, our providers, our nurses, their heart is broken at what happened last night. Some of you, I'll just update you a little bit on some of our numbers. Not much has changed since earlier this morning. We continue to have 8 patients who have been admitted to our hospital after having 14 patients arrive last night over a 45-minute span of time. Of those patients, unfortunately, 3 of them passed away. The 8 patients, we still have 5 in stable condition and 3 in critical condition. To give you a nature of what we were dealing with last night, we had approximately 50 providers, nurses, respiratory therapists working tirelessly on the patients that we were seeing here. At one point had 7 patients in our ORs. We evolved our team of emergency providers, orthopedic surgeons, trauma surgeons, urologists, and vascular surgeons, and they provided expert and compassionate care to help out these patients, and we're able to unite many of those patients today with their families and loved ones. Our team continues to be resilient despite everything that has transpired over the last 24 hours. We're continuing to provide services for the patients who need us in our community. We will begin taking care of additional patients tomorrow, in order to continue to meet the needs of those in our community. Question was raised earlier this morning around the emotional and mental well-being of our patients and of our team members. We are providing 24-hour coverage of mental health and emotional health support for all of our employees and our team members here, as well as partnering with community agencies, both locally and somewhat distant, for mental health and well-being of our patients. We again want to thank the outpouring of support that we've received. We're continuing to receive requests and offers to help and assist us from medical professionals, service industries, and other community members in our own community while they deal with this tragedy across the state and across the nation. And we are very grateful to serve the people of Central Maine.
John, do you want to mention how many patients were brought from the scene, how many went to St. Mary's?
Sure. Just again to clarify some of our numbers, we had 14 patients brought to us from the scene. Of those patients, 1 was transferred down to Maine Medical Center. 1 of those patients was transferred over to St. Mary's. The remainder of those patients were taken care of here. Any questions?
Mr. Littleson referred to this as unprecedented demand. Can you give us some context as opposed to any kind of typical night or even an extreme
Well, it's certainly it's unprecedented insofar as the severity of the injuries and certainly the attack on the community. Our team is prepared to deal with mass casualty incidents as this one was, and in terms of the volume of patients that we saw of a very short period of time, that certainly rises to a level that we don't often see. We may have seen something like this just a few times in other major incidents, but certainly last night was very difficult. And what made it more difficult was the fact that this is our community. A lot of our team members work and live in this community. They know people in this community. They had family members and loved ones and friends who may have been out in these establishments last night. So very difficult for them, but they persevered and took care of the patients that they needed to take care of.
Yeah. What do you want people to know about what it was like to take care of these kinds of injuries, these gunshot wounds?
We have real expertise in our. I mentioned many of our surgical specialists. They have expertise in these areas. I would say, and I'll pass along some of the words from both our chief of surgery and our chief of emergency medicine at the pride that they felt in not only the providers, the nursing staff, but all of the support staff, and how they were able to take care of so many patients as quickly as they did and as well as they did. Yes?
How many would you say are in critical condition or on their way to recovery?
Yeah, again, we have 8 patients right now in our hospital. 5 of them are stable. 3 of them are in critical condition, and we're continuing to monitor their condition closely.
Can you give us a sense of the ages of the patients?
At this point, we're not releasing that information. We're working in conjunction with law enforcement agencies.
Are any of those patients still unidentified?
At this point, none of the patients that we have here admitted are unidentified.
You said you had 50 staff members working on that. Did you call in all available staff?
So the way it really worked is that, in fact, we alerted our team members that we needed additional staff members here. We don't specifically call in individuals, but we work in a really close-knit community, and once the call went out, we had people coming in and helping. So, we had about 50 people working actively, and then we probably had another 50 or so individuals who were just standing by, ready to help. And we needed that help last night. We had obviously a lot of people from the community who were gathering around the hospital who needed our support, so we were able to provide that to them.
Are the families able to visit with the patients that remain here?
We've had families visiting with patients today, and we'll continue to do so. That's an important part of their healing process as well.
I know you say you have experts with these kinds of gunshot wounds and that you're prepared for a mass casualty event. Had you had specific conversations with your team about a potential mass shooting in the past and what the plan would be?
We have. We drill on these types of scenarios, multiple times a year. All of the individuals I mentioned, especially the trauma surgeons, the emergency nurses, the operating room nurses, they drill on these types of situations, so they knew what to do and how to do it, and they handled it expertly.
How recently did you start with those training exercises?
Oh, we've been conducting those training exercises for several years. Yeah. Any other questions?
Have you dealt with any issues of lack of blood donations?
We have not. As Mr. Littleson described, we have great community partners, and we were able to get really more than adequate blood supply last night. We've continued to have that blood supply. I know that's been a request. A lot of people have been asking, can we donate blood? At this point, again, our preference first and foremost is for everyone to shelter in place and stay safe. At some point, we'll need additional blood supplies, but at this point, we're okay.
How are you holding up?
Thanks for asking. It's been a long 24 hours for myself as well as all of our team, but we're hanging in there together, and that's what's important.
Thanks, everyone.
All right, thank you.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.